Hi everyone, my name is Derrick Bush, and today I'll be talking on hidden pathologies, the diagnostic benefits of a CBCT on craniofacial diagnosis. But first, I'd really like to thank my principal investigator, Dr. Kimberly Jones Rudolph, as well as acknowledge Roseman University and our Clinical Outcomes Research and Education Department. So today, as we speak about CBCT imaging, we're really going to focus on the difference between CBCT imaging in contrast to standard two-dimensional imaging or standard X-rays. So since the induction of dental CBCT imaging in the early 2000s, there's been a large increase in overall popularity. And in fact, since the induction of CBCT imaging, pathology found in patients has increased from about 8% to 24%. And then due to this increase of pathological findings, studies have actually been able to more accurately predict some of the more common pathological findings that may be in the craniofacial area. So things such as presence of foreign bodies, dental abnormalities, airway anomalies, TMD, cervical vertebrae anomalies, and so on and so forth. So it's really been cool to see that, since the induction, there's actually been an increase of us finding these things that can really affect our patients. And while we can't, deny the importance of two-dimensional radiograph imaging, um, in most instances, pathology, when present, can be seen in two-dimensional radiographic imaging, but really the ability for us to see all aspects of that pathology, we can't properly do. So really we can't see things like the width or length or height or the amount of involvement of surrounding structures. And so that's where 3D imaging really comes into play, when we can take a CBCT and really do proper cuts of whatever pathology that was found, to really see how involved it is in its surrounding structures. So really the purpose of this study is to analyze certain pathologies or certain anomalies found in certain patients and just see if there is a discrepancy between two-dimensional imaging and three-dimensional imaging. And so kind of how we went about this, the methods of this study, was we took, or we're going to find, 5 patients that have been treated or are currently being treated at Roseman University Orthodontics, who, after taking our CBCT, have a radiographic anomaly. And basically, we're going to present each patient in a case report type format with multiple radiographs, including a standard two-dimensional lateral cephalographic view, and then a CBCT imaging or cuts from a CBCT image. And then basically we will compare the two, see if there's any discrepancy between the two, and then explain the relevance of why this matters in orthodontics and then just general dentistry. So as you can see under the results section, we have 3 cases so far that we've picked. Case A, which is our top left case, is a 37-year-old Hispanic female who presented to the orthodontic clinic wanting braces. After taking our CBCT image and also our lateral ceph, it was noticed that she has an occipital bone spur with growth in the craniocaudal direction. If you take a look at the lateral ceph, it was noted that the width of that bone spur was 7.2 millimeters. However, when we measured it with the actual CBCT image, the measure of that, its width was 8.3 millimeters, so about 1.1 millimeter in difference. When we did the actual height of the bone spur, it was a lot closer, where we had 7.2 millimeters with the lateral ceph versus 16.9 with our CBCT. So really, when you look at the discrepancy, that was only about 0.3 millimeters. Or if you want to do percentage, it would be 13.5 or 13.25% and 1.74% respectively. And so that was just kind of interesting to see that, while the length of the actual bone spur was pretty similar, the width of it with the amount of involved structure was actually about 13% difference, which is a pretty significant amount. When we move on to our case B, which is our second patient, which is that bottom patient under the results section, this was actually a 29-year-old Asian male who again presented to the orthodontic clinic, and then present in both the lateral ceph and in a 2D image cut from a CBCT, you can see that this patient has a calcified pineal gland. The interesting thing about this though is that, if you were not using CBCT image to get the different sagittal and axial cuts and really analyzing, you might miss this finding just to do how small and unremarkable it shows on the lateral ceph. However, when you take the CBCT cuts, you can really see and really appreciate the actual calcification that is taking place in that little dot that kind of just appears there, and it really pops out a lot further. And so, while it's not a huge anomaly, it is important to present to the patient that, hey, you are getting this calcification going on. And this may affect, the amount of melatonin that's being produced because of the calcification of this gland. You may have sleep issues, which is important for us if they were to report this in the near future, or just any time in the future. We could kind of help the patient realize why this is happening. And then finally, on our third case, or case C, which is the top right under the results, we have a 37-year-old Asian male who again presents to the orthodontic clinic. And then upon initial assessment of the lateral ceph of the 2D image, it appears that there really isn't anything remarkable besides a mild occipital bone spur again, but nothing much more than that. However, upon taking a CBCT, we really found two things that stuck out to us. The first one being that this patient looks to have a mesiodens located in the incisive canal, which is actually quite uncommon with it having being right there in that incisive canal. So that was pretty cool that we could point that out to the patient and say, hey, you have this going on. And then the second artifact present appears to be the onset of some type of calcification happening within the spinal column. And so again, you can kind of see that. That would be the last picture on the right, where it has a little circle around it. So again, it does show a little bit of calcification going on. And while neither currently presents with any immediate danger to the patient, both can have long-term negative health effects and should be monitored periodically. And so basically, just in conclusion, so what we have so far is that, while we're still in progress and cannot come to a definite conclusion, we hope to find at the end of the study that 3D imaging does indeed provide diagnostic benefits over traditional 2D imaging. It is our intent that with this data, we can more fully appreciate and diagnose pathology in an effort to properly treat such pathology the most effective way possible. As healthcare providers, that's what we strive to do, to help our patients, to treat them in the most effective way possible, and to really bring about a more positive change. I hope you all have enjoyed this presentation. If you have any questions, please let me know. But thank you all.